All right, so the injury is rolling a car multiple times. We don't even know how many times the car rolled, and you're left with dizziness.
Yes.
And we did the scan. We had you turn your head to the left, turn your head to the right. We did a few different things here. Just looking at you from behind, we can see that you were born with a vertebral artery on the left that is dominant, and the one on the right is almost non-existent. We did ultrasound on it. It does exist. There is blood going through there. It's patent. However, when you get a sprained neck like this, and we did evaluate you, your atlas slides too fast and too far to the left, and it goes too far forward on the left. The ligamentous integrity is compromised, that it's not keeping you from being able to go from going too far. And with left and right head rotation, when you have an artery that's this narrowed, that might be what's giving you your dizziness. Oh, and by the way, after we adjusted you, your dizziness was gone?
Yes.
For the first time in how long?
Oh, I'd say at least 2 years.
2 years?
Yes.
All right, so proof of concept, we adjusted the atlas, and we did put a collar on you. We didn't want you to move your neck around too much, although you did kind of move your neck around a little too much. All right, so the dizziness went away for the first time in 2 years. That's nice. So again, the current working diagnosis, the atlas moves too much. You sprained this upper neck, and because of your anatomical variant, you were born this way.
Okay.
That's where your dizziness is coming from, probably from this vertebral artery being. Oh, that was the other thing, is that we did trace this vertebral artery up. You can see it, and then right here where it meets the atlas, this hypermobile atlas, subluxated atlas, you can see where it kind of drops into nothing. Again, we're thinking that the artery might be a little swollen and irritated from that hypermobility and that subluxated atlas. So you can see how it changes right there. All right. And there were a few other things. There you can see the atlas digging forward on the jugular vein on the left. That was another little interesting thing. When you bring the curve back, when we do curve correction, your symptoms, you got a lot of symptoms in the front of your neck, and we do find an injury in the front of your neck here. So here you can see that this hyoid looks like it was broken at the growth plate and then healed and calcified in the wrong position. You can see how the hyoid is digging into the between the internal and external carotid arteries, the bifurcation on the left. You can see how it's nowhere near the artery on the right, and it's pulled down. Now, when we look at the normal anatomy book, the only thing that makes sense in here is the ligamentous connection between the thyroid cartilage. And we should probably show that normal anatomy book, and we'll do that at the end.
Okay.
What else do we have in here? All right, so you did notice an improvement when we mobilized these styloids.
Yes.
So you can see how this styloid particular is very thin in through there, and we had you jut your jaw forward, and it does move. So today we mobilized and we got in there, and they move on both sides. So we actually put a little force in there yesterday and got those to move. I'm not going to say we broke them loose; they were already loose and moved, but we got them to where they're moving better.
Okay.
And those do attach to this hyoid.
Okay.
What else did we want to talk about? Well, we did take a full inventory of you, so we found other things that were worth mentioning.
Yes.
So this is the abdominal CT scan with contrast, and here you can see this little indentation there. So that's where the median arcuate ligament digs into the superior mesenteric artery. Now, is it digging in enough to cause symptoms? It may. You probably want to see somebody who's an expert at MALS. That's what they call it, median arcuate ligament syndrome. So you do have that in play. Let's see what else. This is this left dominant. That was the other thing. This left dominant vertebral artery of yours is so large and so dominant, it actually occupies a lot of space in the spinal canal. So as an atlas doctor wanting to adjust the atlas and get it right, I care about, and there's of course the normal anatomy showing you what it's supposed to look like. There's your hyoid in its normal orientation.
Okay.
Screenshot of that, where it gets diminutive. Right, so here's So somebody who adjusts the Atlas like myself, we care about making sure this is all in alignment. And this space occupying artery does throw a bit of a monkey wrench in it. It does change things. So when we look at you on x-ray, any doctor who evaluates you on x-ray is going to adjust you a certain way. But this tells the rest of the story, and this might be why you didn't respond to the Atlas adjustment that you got by the doctor who was just going by x-ray. There's that hyoid. Another view of the hyoid being stuck in between the bifurcation on the left. Another good picture of it. There we are. And rolling the car several times. And we did find that these ribs on the right side were not where they're supposed to be, and we adjusted those quite a bit. We would recommend prolotherapy on this first rib to kind of tighten that up so it doesn't move so much, to help the scalenes modulate better.
Okay.
There's a disc that's compromised. Another view of the styloids. All right, so we drew a line through the center of your foramen magnum, and look at that. You can tell I'm obviously trying to find the center there, and look at this thing occupying so much space.
Yeah.
And we adjusted you and accommodated for that. Here you can see how far the Atlas is anterior. Just in the neutral position, your Atlas is anterior 5 degrees.
Okay.
When you turn your head to the left, the Atlas slides forward to 8 degrees, and let's show you that. That's how much it slides forward, a little too much, and we showed when we reduced that, you got a lot better. And when you go the other direction, it goes down to 4 degrees.
Okay.
So we know it does move. There's C2. There's when you turn to the right, it reduces to 4 degrees.
Okay.
And that's what we think we did for you today. Oh, here's a good shot. So left head rotation, you see how far it goes to the right, not crazy. Right head rotation, the Atlas slides too far to the left, and that's going to be the way to knock yourself out of adjustment. So please don't turn your head too far to the right. That's where you're vulnerable for 6 weeks till the ligaments heal up.
Okay.
And or prolotherapy wouldn't be a bad idea to help that hold better. So here we have you jutting your jaw forward. So the idea of a dental appliance that holds your jaw forward to help with the venous drainage is a good experiment to run.
Okay.
Yeah, and we do see evidence of an old injury here. So we saw the first rib down. Looks like the jugular vein the valve in there might have gotten injured. And I'm not saying that everything we're finding here is actionable information, but it is notable. Skip this. Yeah, so there's your vertebral artery being pulled on the left. When you turn your head to the right, it slides up too far, too fast, and it does border that vertebral artery. And when we did ultrasound on you, it was very easy to compress this vertebral artery. A little surprising how easy it was to compress. And you, at the arteries in the top have, what's the name of that they found?
Fibromuscular dysplasia.
Fibromuscular dysplasia shows scalloping inside the arteries in the upper neck. And to me, it looks like trauma, especially with the hypermobility or sprain that you have up in there. And when you're weight bearing, we notice that your C2 does go too far to the left, and there's some displacement here. So again, the rationale is to do prolotherapy on the back of the neck, bring the curve back, except that what's going on in your anterior compartment seems to be more important. Kind of like somebody having a rock in their shoe, and then we come along and try to make you straight. We put more load on the rock. That's kind of what you're seeing here.
Okay.
So again, the biggest confounding or interfering problem, and things interfering from you bringing the curve back, is what this hyoid is doing in here.
Yeah.
So you're gonna probably get some dry needling in through here. The SCM, by the way, is enlarged on the right, and that we do believe that that's a primary injury as well. because you can actually injure a muscle so badly that it's a primary. Any questions? Anything you want me to talk about?
I don't think so.
Okay, thank you very much.
Thank you.